it promotes awareness about lung cancer by changing the public perception of disease. Their mantra is, anyone with lungs can get lung cancer. And the White Ribbon Project, importantly, is a symbol of unity. As the White Ribbon Project founders Heidi and Pierre Onda from Colorado in the States note, every ribbon says you're not alone, which is a powerful message for a newly diagnosed lung cancer patient. The interactive process of building, asking, and sharing takes the project beyond public awareness education, and it brings the community together with a high impact potential, okay? And we'll talk more about the ribbons in just a minute. Between October 2020 and May 21st, Pierre and Heidi made, get this, 678 white ribbons in their garage by hand. Painted them, cut them, finished them, put the stickers on them, and gave them out in the lung cancer survivor community, in the clinician community, across the United States and Canada. The number of major lung cancer organizations and cancer centers that have joined the movement is growing every week. And we're so happy to say that we joined the movement as a company a few weeks ago. We had a top white ribbon event where our team cut, painted, and built these ribbons to be given out into the community themselves and by people like you today as you receive your ribbon and other ribbons to pass on. Most importantly, the White Ribbon Project includes everyone because this is a grassroots awareness campaign. And I think finally, through this event and our collective efforts to spread the word about the White Ribbon and lung cancer awareness, we can provide hope to the community that there are solutions out there that they can benefit from today, tomorrow, and in the future. So with that introduction, I'm going to introduce my friend Dave Bjork. Dave Bjork is the self-described research evangelist. Dave's a patient advocate, a lung cancer survivor, a speaker, and an advisor. And his career spans more than 20 years with progressive experience at places like the National Foundation for Cancer Research, where Dave launched several fundraising and advocacy programs and became known as the cancer research evangelist because of his dedication and commitment to basic scientific research. Dave's made it his life's mission to connect individuals, advocacy groups, pharma companies, and others to forge strong partnerships to grow research efforts. Currently, Dave's a VP of Empowerment at Grit Health in the States, and he's a board member of the White Ribbon Project in the US. And through Dave's Research Evangelist podcast, which I highly recommend you check out, which is nearing its 50th episode today, Dave strives to be a pure voice for science in a time where it's needed. So Dave, let me turn things over to you.
Thank you so much, Bill. And hello, everybody. I'm on my phone because Verizon is like down today, so I'm like having all kinds of internet problems. So, so bear with me today. But thank you so much for having me today. And I'm super excited about the build that you guys have done and the involvement that you've gotten with the White Ribbon Project. So my story is real quick. My story, I'm a lung cancer survivor and I'm a patient advocate, and I'm a board member of the White Ribbon Project. And what excites me about the White Ribbon Project is if you think about the story about the White Ribbon Project, it was Heidi Onda in Denver, Colorado, who was diagnosed with stage 3 lung cancer, and she wanted to raise awareness during Lung Cancer Awareness Month, and she got no support from her cancer center and others in Colorado. So she said, I just wish somebody could make me a ribbon that I can put on my door, and I can just tell the world that I have lung cancer and there's no shame in having lung cancer. So her husband, who is a primary care physician, he said, I'll make you a ribbon. He's not a carpenter, he's not a woodworker, but he said, I will make you a ribbon. So he made a ribbon. He made a ribbon and it's put on the front door. And Heidi shared that with the world, and people started saying, can I get a ribbon? Can I get one of those? Can Pierre make me a ribbon? And I caught wind of it because my friend Chris Draft told me about it. He said, you've got to get involved with this project. And I was like, this is amazing, because it's like, Heidi Pierre didn't set out to like change the world, but she just wanted to tell the world that she had lung cancer and it's okay to have lung cancer. And whether you have a smoking history or not, it doesn't matter. Nobody deserves to have lung cancer. So from that original ribbon that still is on Heidi and Pierre's front door, we have built ribbons around the country in the United States, as well as Canada and parts of Europe, the Philippines. It's just growing. It's just growing, and I'm happy. Jill Hammer Wilson is here today as well. My colleague from Canada, who has done amazing work in her community and building awareness and helping spread the word about the White Ribbon Project. So the important part of the story, Bill, is that ribbon, it's like every ribbon that's made is made by hand. It's made with love. It's delivered with love. It's received with love. And to tell people that you're not alone. If you have lung cancer, you are not alone. But it's not just the patients. It's the caregivers. It's the clinicians. It's the cancer centers. It's social workers. It's nurses. It's everybody. Firefighters. Everybody can be involved with this project, because anybody with lungs can get lung cancer, right? And so that is truly the mission of the White Ribbon Project. That we are trying to change that public perception that anybody can get lung cancer, right? So, and again, I stress this, that whether you have a smoking history or not, a lot of people are getting lung cancer who have never smoked or they quit smoking. And so it's really a message of love that we want to be like the breast cancer community or the HIV community many years ago, to really change the public perception. It's not just about don't smoke. It's about anybody can get lung cancer. So thank you so much, Bill. Thank you, Steve, and all of the colleagues at Breathe BioMedical for everything that you're doing to support the White Ribbon Project. I really appreciate it.
Great. Thank you, Dave. Okay, and let me announce and introduce Jill Hammer Wilson. Jill Hammer Wilson is a stage 4 lung cancer survivor and advocate who works with many research teams and organizations to improve outcomes for people affected by lung cancer across Canada and internationally. She's the international liaison for the White Ribbon Project and has helped the White Ribbon Project set up multiple White Ribbon building events to support the project. And Jill was our key liaison to set up our White Ribbon Build event, which went off so successfully over the past month. The White Ribbon, we're so grateful that Jill could connect with us today virtually to tell her story and to be involved in bringing this White Ribbon Project to Canada and to Moncton with us through our efforts. So Jill, let me turn it over to you to hear a little bit about your story.
So thank you so much. And it's great to be here. I want to express deep appreciation to the Breathe BioMedical team and all the esteemed guests who are here, because your support of people affected by lung cancer and of the White Ribbon Project, it means so much to us. Thank you very much. Now, back when I was a young engineering student, I had no idea that anyone could get lung cancer. And even in my early 30s, when my mom's best friend's husband, who was a firefighter, when he was sadly diagnosed of lung cancer, I still had no idea that anyone could get lung cancer. I thought you had to have had a smoking history or exposure to radon or other workplace kind of exposures. I had no idea that anyone could get lung cancer. I didn't even know that, an active mom with young kids who had a cough that was persistent following a cold, that she could find herself diagnosed with lung cancer, because anyone can get lung cancer, right? And that's exactly what happened to me back when my kids were 6, 10, and 12. My youngest was just starting in grade 1, and I had this cough that didn't go away. So went to the doctor, and it took a long time because I didn't have those more common, um, exposures. Lung cancer wasn't on my doctor's radar either. And it's a really tough diagnosis. So I'm really thankful for research because it means that I've been kept alive by my terrific medical team for almost 8 years now. I'm actually on my 7th line of treatment right now, which is pretty amazing. Think about all the research that's gone into helping keep me and others like me alive. So thankful, just so incredibly thankful. And, as you know, research not only brings new treatments, research really matters because it renews our hope. It helps us keep going, and hope matters. And thanks to research and my team and hope, I'm still alive and still in my kids' lives, which is so important. And my kids are now 14, 18, and 20. My oldest is now in his 3rd year of university. He's studying electrical engineering and physics and really doing well. And it just feels like a miracle that I'm still here, because my cancer was caught at a later stage. My cancer was caught at stage 4. And sadly, about 3/4 of lung cancers are caught at later stage right now. And wouldn't it be better if we caught lung cancer in time for it to be cured? Wouldn't it be better if we caught more cancers at earlier stages? If we could just cut it out and give that cancer a really good kick and then never have to worry about it again. I mean, wouldn't that be so much better? Because early detection really matters. And with current technologies that we have now, low-dose CT scan, when they're used, they can make a powerful difference. And roughly half of the people who are diagnosed with lung cancer would get an earlier stage diagnosis than instead of a later stage. I don't know if that makes sense. I mean, these are really rough numbers, but right now, about 3/4 of people are diagnosed later stage. And if they did CT scans, these low-dose CT scans, as part of routine testing, instead of 3/4 being diagnosed roughly at later stages, roughly 3/4 would be diagnosed at earlier stages. And that's why early detection really matters, because at these earlier stages, there's much greater potential for cure than there is at later stages. And that's what we want, right? It's great that research is keeping people like me alive, but wouldn't it be better if we caught it earlier? So early detection really, really matters. And exciting new advances like Pettipot and Breathe BioMedical, the same company, like their research shows promise of even better numbers, better outcomes, and more life. And so I'm here this morning to say thank you very much, Breathe BioMedical, Pettipot team, for your support of the White Ribbon Project, because the research you're doing gives us hope, right? And your build that you've done over the past few weeks is sending out a tremendous message to the lung cancer community, which, as Dave said, includes so many more than just people actually diagnosed. It includes our families and friends, our communities, our care team, social workers, physiotherapists, and so on and so forth. So many people care about us, and you bring you help us grow as a movement, which is sorry, I'm back. A few technical difficulties this morning. But the White Ribbon Project has been tremendous for empowering and encouraging people affected by lung cancer to advocate more. And we already have to advocate for ourselves, right, to get good treatment, to get the best treatment. And you know, going to the doctor and getting that cough checked out, that's important. But we're advocating more, which is wonderful. We're feeling more supported. So I want to say a really big thank you to Breathe BioMedical, to the Pettipot team, to esteemed guests. Thank you. Thank you for your support of the White Ribbon Project and people affected by lung cancer. Thank you very much.
Here in Moncton. Next, I'd like to introduce Heather Hogan. And Heather is our local lung cancer patient advocate who we partnered closely with in the past. Heather is a lung cancer survivor and an advocate for lung cancer who's dedicated countless hours to supporting and mentoring lung cancer patients. And you know, that mentoring role is a very powerful role because patients are diagnosed and sometimes they don't know what to do. They don't know what to think. How's it going to impact their family? How's it going to impact their career? What are the treatment options for them? There's so many questions that they have. And to have people like like Heather to turn to, and Jill and Dave for that matter, is extremely important. And that's such a powerful role that they play in this community. But included in her efforts for support of patients, she's also created a Facebook page for Canadian lung cancer patients called Canadian Lung Cancer Advocacy, Breathe Hope. And we're honored to have her here today to talk about her story and her involvement in the White Ribbon Project and lung cancer advocacy. So Heather, please come on up.
Thank you, Bill.
Yep.
As you know, my name is Heather Hogan, and in 2012, I was diagnosed with stage 3A non-small cell adenocarcinoma lung cancer. I was 52 at the time, and I was one of the fortunate ones. I had had an abdominal CT scan in 2010, and a very perceptive radiologist noticed my abdomen was fine, but there was a little shadow up in the corner of the x-ray. And from that point on, for 2 years, we watched this little shadow, little spot. That could have been anything. Lots of people have little spots. However, after 2 years, my little spot grew. And so I was proceeded, and I went into, I had 2 lung surgeries. We thought perhaps I'd be stage 1. However, after my second lung surgery and removing several lymph nodes, I had cancerous lymph nodes, so which put me at a stage 3. Everything kind of fell apart for me after that. The statistics for stage 3 and stage 4 are not good. And I was given at the time 15% chance of living 5 years. So what do you do with that? However, I am still here, which is, I can't explain it, except that after I've retired from my teaching job, this has been kind of the thing I do. I am pushing for lung cancer research, early diagnosis, and trying to help build this lung cancer community. So with my husband, who is been with me for the last 35 years, he's walked this journey with me hand in hand, and I'm not quite sure how I would have gotten it through without him. In terms of lung cancer communities, it's a very different group. Very rarely when somebody is diagnosed with cancer, do you have somebody say, oh, I didn't realize you smoked. So the problem is with lung cancer, we face a tremendous stigma. And so there are a lot of people who keep their diagnosis quiet. There are a lot of people who don't hear about positive stories. So if there's any suspicion, sometimes they just don't want to know. They won't pursue it. And then they keep it quiet because there is a stigma and there is a feeling that they have done this to themselves. And other people make a suggestion that they have done it to themselves. And as Jill and Dave just talked about, we now know that anybody can get lung cancer. The largest growing group of lung cancer, of people diagnosed with lung cancer, are young females who have never smoked. That's scary. So that's why it's so important to build this community of lung cancer patients, because when it started, I had nobody to talk to. The only people that I ever heard about with lung cancer are people who had died. And that's not what you want to hear when you're diagnosed with lung cancer at 52. So I found groups in the US, and that was a great source of support for me. And through their work and social media, several of us joined together, and we started, Jill was one of them, and several others, and we started the Facebook group. And we now have well over 200 lung cancer patients in Canada. And during this last couple of years, when Heidi had started with the White Ribbons, two of our members, Kim Moore McIntosh and Marianne Bradley, brought those ribbons across the border. And those ribbons were manufactured by, just as Dave said, lots of people who have lung cancer, and we started distributing those. And unfortunately, one of the members, Kim, passed away yesterday. She had been diagnosed with stage 4 lung cancer. So we've lost a lot of good advocates over the last month, and it's been a really hard time. However, this campaign helps us, and just having people around helps us to address the stigma. It takes that away. It tells everybody out there that there are people that care, and that's what's most important. And the research that this company is doing is amazing, and I've been so excited about it, and it's so exciting that it's here in the Maritimes, which is phenomenal. So we have ribbons that have been made, and we're going to be passing those out. And I believe that's my part of the story. Do you want me to go right ahead? So one of the other things that I'm very excited about this morning is I've been carrying around a ribbon that was made by one of our Canadian lung cancer patients, Caroline Johns, and her husband. And I've been carrying it around for a special person who happens to be our next recipient, who is my oncologist. And so I would like to introduce Dr. Abdel Salam, and he's the head of hematology and oncology at the Moncton Hospital. And Dr. Abdel Salam has dedicated time and research efforts and support for lung cancer during his career in an effort to find a cure and improve treatment and screening methods for this deadly disease. As someone who sees lung cancer on a daily basis, we are honored to have Dr. Abdel Salam here with us today to talk about lung cancer and the importance of awareness and initiatives to improving research. And yes, this is a very personal, and I'm really excited to be able to give him this white ribbon. Dr. Abdel Salam. Do that? Yeah. Okay. Momentarily.
Thank you.
Here, you can say a few
Thank you so
words.
much. Thank you so much. I would like to thank Heather for nominating me for that white ribbon. It's a great honor to me to present my team. It's actually not for me. It's for the whole Sheldon Robin Oncology Clinic people working there, the nurses, the pharmacists, the clerks, the admins, the research center. So we know that lung cancer is still the leading cause of death among all the cancer subtypes. I have heard lots of words here that everybody could develop lung cancer, but still you can reduce your risk to get the lung cancer by quitting smoking and have healthy style of life. That's very important to highlight. It's very important to aware people how to have healthy style of life. We have evidence that there is 30% of the cancer related to style of life, including what do you eat, what's your habits, you do activity, you have exercise, you walk, there is style of life can protect you, not 100%, but at least reduce your risk to get cancer. And we know that 90% of lung cancer related to smoking at the end. So there are 10% still not related to smoking. The second issue is if you are like one of the high risk, we need to start screening program here in the province. That's very important. We don't have that. And I'm very excited about the results of the Petticoat. I was part of the research for the Petticoat, and it's for me, it's very promising. We're waiting for the results in the future, and I hope that will help to detect more cases early so we can cure more patients, not wait long till they have stage 3 or stage 4. Where we have like small percentage. It was 15% in 2012. Nowadays, 30% for stage 3, and we have 20 to 25% of the stage 4 right now. They can live up to 5 years. So we are improving. The outcome is improving. That's related to hope. So for the patient or for those are heavy smoker, please don't wait if you have any symptoms. Check with your physician, go for any test you can do. For the patient, we need to tell them that there is lots of hope. We're working. There are lots of new medication. When I started working on oncology in late 1990s, it was only chemotherapy for lung cancer. Nowadays, we have many subtypes of lung cancer that we can treat with pills. When we detect some gene causing the lung cancer, we treat with pills. And the results, some of these subtypes, they live more than 7 years, although they are stage 4, like ALK positive. So there are lots of hope coming, and the immunotherapy changed the outcome significantly. In Moncton, we are doing the best to be up to date, get the latest and updated treatment for our patient. We have a research center. We are part of many global research. We are doing we have almost not less than 15 clinical trials ongoing in lung cancer, different stages, and other types of cancer. We have many other research. So we're trying to be updated and get our community the best treatment we can, and we'll keep doing. The last message that we need to keep people aware about lung cancer, other types of cancer for sure, but we are talking today about lung cancer because really it is something you can prevent your risk. And if you detect it early, you can be cured. And if unfortunately you have stage 3 or stage 4, still there is hope to work with you and get you the better and the best treatment and the better survival we can do. Thank you again. It means a lot for me to get to be presented. It's a great honor to me and my team, and thank you so much. Thank you, Heather.
That's why I'm so happy he's my oncologist. I think I cried the first time I met him that I couldn't talk a whole lot. So, but I think we're better now. So next up, I would like to introduce Jeanette Pettipot-Taylor. And she is the Member of Parliament for Moncton Riverview Dieppe. The Honorable Jeanette Pettipot-Taylor, born in Dieppe as the youngest of 9 children. Jeanette earned her bachelor's degree in social work at the University of Moncton. After working briefly for the Canadian Mental Health Association in St. John, she returned home and embarked on a 23-year career as Victim Services Coordinator for the Kodiak Regional RCMP. Through her work, she became known as someone who cared deeply for her community, and to many, she was a warm and reassuring presence in difficult times. Seeking a new way to serve, Jeanette ran for federal office in 2015 and was elected Member of Parliament for Moncton Riverview Dieppe. After serving successfully as a deputy whip of her caucus and parliamentary secretary to the Minister of Finance in August 2017, she was named Minister of Health and worked on behalf of all Canadians in many challenging areas of public health. Recently, she has also taken on a new challenge of serving as Canada's Minister of Official Languages and Minister responsible for the Atlantic Canada Opportunities Agency, ACOA. Every step of the way, Jeanette has been defined by her willingness to help those in need. So I would like to welcome the Honorable Jeanette Pettipot Taylor. Oops, go this way.
Well, good morning, everyone. It's an absolute pleasure to be here today. Greetings to Greg Turner and also Bill Hogan, members of the provincial legislature, and also our Mayor, Don Arnold. Thank you for being here. I have to say, I was given some prepared remarks today, but I think I want to speak from the heart. First and foremost, thank you so much to Dave, to Jill, and to Heather for sharing your story today. When we talk about awareness, it's really important to make sure that we have people with lived experience sharing their story. Not only do you advocate for your cause, but you're also playing a role of educating all of us. And until that I took part in this event and before that I read the speaking remarks, I never realized the stigma that was associated to this type of cancer. And again, by being out there and sharing your stories, it is truly, truly important to educate us. Having been a former social worker for a number of years, I've really been involved in a lot of ribbon campaigns. And they're not just ribbon campaigns, they are educational campaigns, and they make a huge difference. So please continue the work that you do, because it is truly, truly important to make sure that we educate people to make our world a better world. I would be remiss not being the co-minister, not talking about the innovation as well that is happening in our community. And I think, Heather, you said it earlier, we certainly don't talk enough and celebrate enough the work that is being done and the research that's being done in our community. As Atlantic Canadians, we're so humble. We just kind of, we don't brag about the things that we do. It's really time to celebrate what we are doing in our communities and to really promote those really good stories. So once again, I want to thank you, Bill, and thanks to everyone for inviting me here today. It means an awful lot to me, and I'm truly appreciative and proud to be accepting this white ribbon. Merci beaucoup tout le monde.
Thank you. And it's really nice to have both provincial and federal representatives here, because lung cancer and screening and research are things that I talk about all the time, and they're a little bit expensive. So we like to make sure people are in the know. Next up, I'd like to welcome to the podium Mr. Greg Turner, Moncton South's member of the Legislative Assembly. Mr. Turner has been an engaged and enthusiastic leader in the community of Moncton for over 45 years. Greg graduated from Sir George Williams University School of Retailing and was the proprietor of Colputt's Menswear along with his wife Claudette for nearly 40 years. He is also a former councillor at large with the City of Moncton, including one term as deputy mayor. Notable events Greg has led include Turner's Christmas at the Coliseum, the Speed Sport Car Show, the Victorian Park Arts and Crafts Fair, and the Magic Hands Festival of Fine Arts. As a significant community voice for Moncton, we are honored to have Greg here today to talk about lung cancer and the stigma surrounding this deadly disease. Greg?
Thank you very much, Heather, for your introduction and your kind words. And really, I want to thank the folks at Pettipot. We really, really are excited to be here today. I want to recognize right off the bat Minister Pettipot Taylor for being here and the contributions through CODA and the great work that's being done by the federal government here in Atlantic Canada. Great to have you here. Mayor Arnold, always a pleasure to see you at an event and talk about enthusiastic individual. It is our mayor, and so wonderful to have you here. I'm really pleased to welcome my associate as well, MLA Bill Hogan, who is our caucus chair, and welcome to Moncton. He's all the way down with his wife Heather. We've heard from Carleton County, so we're pleased to have you here as well. And obviously, the work being done here is really near and dear to your heart, and I'm just pleased to be here to be part of it. Actually, it's quite humbling. I was elected about a little over a year ago, and soon after being elected, I received a communique from the folks here telling me about the work they're doing in my riding. I had no idea. I had a lifelong resident of Moncton. I didn't realize what was going on here. And they assured me they'd invite me over for a tour and an open house as soon as COVID had kind of settled down. Well, unfortunately, it didn't quite happen. So here I am today, finally. We've made it through the door. So I thank you for that, and thank you for the crowd being here. You probably know our government just released a new health strategy yesterday officially, and research and development is a major, major part of our health strategy going forward. And I want you to know that we are committed to working very, very closely with the health authorities and in the research being done in this province. We're very proud of the work being done. I was fortunate enough earlier in the week to have the Minister of Health start her tour of the province and unveiling health plan on Monday in Moncton South, and we were able to arrange for her to be presented with a white ribbon. So that was quite nice, because you may or may not know she is a cancer survivor. So this is really near and dear to her heart. As well, on Tuesday in Fredericton, we were able to get a white ribbon to the Minister of ONB, Arlene Dunn, and the ONB is very, very, I know, involved with the project here and the work being done. So we're appreciative of that relationship, I guess. And Premier as well, Blaine Higgs, was presented with the white ribbon on Tuesday as well. So it's great to have those people, I think, involved, but we just want you to know that our government is very, very much involved and very, very supportive of what's going on here and the great work. I'm looking forward to seeing the tour. I remember the days when this was ATV, and I really didn't realize that you had taken over. Grand Prix wrestling was just out back. I remember, as a kid, I remember those days. But anyway, no, it's great to see, to see that you've had the expansion and the growth that you've shown here. And I'm really excited to learn more about it for sure. But thank you for the great work being done. And thank you, Heather, for the great testimony and the great work you're doing to help get the word out there across our country. It's really important. But it's really important it's being done in Moncton, in New Brunswick, and in Atlantic Canada. How great is that, eh? Anyway, thank you very much for this opportunity, and best of luck. Thank you.
Next, thank you, Greg. I'd like to introduce Her Worship, Mayor Dawn Arnold. Over the past 5 years in the Moncton Mayor's Office, Mayor Arnold has demonstrated her passion for her community, earning the reputation of being one of Moncton's most active, involved, and accessible elected officials. And I think Greg just alluded to that. We're honored to have Mayor Arnold here today to receive a white ribbon and talk about the importance of raising awareness for lung cancer. So, Madam Mayor.
Thank you. Well, thank you, Heather. Bonjour tout le monde. C'est un énorme plaisir d'être parmi vous au nom du Conseil municipal et tous les citoyennes et citoyens de Moncton. Yes, it's, Greg's allusion to this being CTV is interesting. I've been here for Christmas daddies and very stressful interviews. So it's really nice to be here today for this. And I'd like to thank everyone involved for the storytelling that has gone on today, because I think by telling stories, that's how we change narratives. And I'd like to particularly thank Petticoat for providing hope to those stories. And I'm very excited. I've just learned today mostly about the role in the creation of hope that Pickamole is doing, and really look forward to Romeo and Jean giving me a tour of the behind the scenes. And as our MLA said, I'm really, really happy to have this groundbreaking work being done in our community. My husband and I have a really good friend who died of stage 4 lung cancer, and he wasn't a smoker. So we know how this can impact people in a really, really profound way. So anything that we can do to raise awareness and make people knowledgeable about the signs and that early detection, I think is incredibly important. So thank you for educating me, educating us, educating our community. It's such an important part of all of this. And thank you for being among us. Merci.
Thank you. Next, I would like to welcome Fire and Explosion Investigator Deputy Chief Charles LeBlanc of the Moncton Fire Department. With over 20 years of experience in the fire service, Charles is an expert in the field of determining origin and cause of fires. As such, he has assisted in many agencies with forensic fire investigations in Atlantic Canada. A recent study published by Dr. Robert Daniels in the National Institute for Occupational Safety and Health found that firefighters are 9% more likely to develop cancer and 14% more likely to subsequently die of cancer than the general public. Given these statistics and other research, it is clear that firefighters are an important stakeholder in the lung cancer space. We are honored to have Charles here today as a representative from the New Brunswick Association of Fire Chiefs to talk about the impact of lung cancer on firefighters. So, would you like to join us? Down there for you.
Awesome. Thank you. Good morning, everyone. On behalf of the City of Moncton Fire Department, as well as the New Brunswick Association of Fire Chiefs, I would thank you very, very much for inviting us here. And I think, as a lot of my previous speakers have said, I've learned so much here this morning. And basically, some of the stories that were said are really, really heart-wrenching. And I think there's so much importance to have those type of stories being brought forward here today. The stigma attached to lung cancer, obviously, is, as we all see that, and growing up and through my whole life, is we always think, and you always hear from people that have lung cancer, obviously it's derived from smoking. And I know that's part of it. The unfortunate part of that is in my career in the fire service, lung cancer is really one of our frontline enemies, just because of the sheer work that we do. Now, over the past few decades, there's been actually great stride made through some research and basically improving the personal protection equipment that we use, SCBA, and so on and so forth. And that has really improved basically our odds as in the firefighting field. The unfortunate part of that is that our environment also changes basically in the way we fight fires. And basically, as we look around today, whether it was 30 or 40 years ago, when we look around, a simple residence is basically mostly everything was made of really core product, just as wood. As we see today in most of our homes, is we have electronics everywhere. So a lot of the stuff and a lot of the fumes, a lot more carcinogens basically in the fumes. Basically, those things can lay dormant for hours after the fire, even days, weeks, and even months. So as firefighters and also fire investigators, as part of my role right now, where that comes in is that a lot of the firefighters or investigators will go in after the fact and start to sift through debris, and will inhale a lot of that. A lot of that stuff is every day we enforce to make sure that they wear the proper PPE to help them. And that is difficult because it just lays there dormant. You don't see it.
As we're moving forward, a lot of associations, such as the International Firefighters Association, has done a lot of lobbying. I know the minister is well aware of that, basically to try to have that recognized through the government. And as such, legislation has changed in order to be able to help that and recognize of how deadly our field can be. Moving forward, as we move forward, basically we're looking at, I know locally here in the Moncton Fire, and speaking from a few people here, we are looking at stuff that, and obviously prevention is the number one that things can help us, the biggest chance of survival. And what we're looking at in the fire service right now is to ensure that maybe as new firefighters coming and existing firefighters, that basically we create health baseline of where we're at, and basically following up maybe on an annual basis to be checked on an annual basis, so that you can have early detection of potential, any type of cancers that we have within our field. Again, I want to thank you so much. I've learned so much this morning. Thank you so much again.
Thank you. Before I introduce our last recipient, I just wanted to mention that part of the White Ribbon campaign is that whole idea of community. And so typically what's happened is that whoever creates the white ribbon signs the white ribbon before it gets passed on. And that lets you know that it was made with care and thought and support, and that when you receive this ribbon, you are not alone. And so that's why it's also important that we share these ribbons with clinicians, with firefighters, with other members of the community, because they're all part of this puzzle. And that's why it's so important that Pettipot is doing this, or Breathe BioMedical, and doing this research, because it's all part of that important community that we want to ensure keeps moving forward, brings early detection and awareness to lung cancer and to other diseases that this technology could deal with. But it's so important that we keep it on the forefront of people's minds. So with that said, I would next like to introduce everyone to Breathe BioMedical CEO, Steve Graham. Steve has led Breathe BioMedical since his appointment as CEO in 2018. His expertise and work experience has positioned Breathe BioMedical to where it is today, with a lung cancer proof of concept study completed and many other valuable studies in progress. Steve is going to talk about Breathe BioMedical's role in lung cancer research, as well as the work Breathe BioMedical is doing to combat the stigma around this deadly disease. And I was really pleased, my husband and I met Steve 5 years ago when we toured here, and just in its infancy, and I was so excited about the technology that I've kept really good track of everything he's been doing, and they've kept us in the loop. So I very much appreciate it. So Steve.
All right. Good morning, everyone. I am honored to be presenting to you as the CEO of the new Breathe BioMedical. I want to thank Jill and Dave and Heather for telling your stories. They really inspire all of us to do what we do. So thank you very much. So I have had the privilege to be CEO since 2018. Since then, we've made some huge advances in breath technology under the name of Pettipot. Today, we've hit a major milestone by changing our name to Breathe BioMedical. It's a name that better relates to our audience and our technology. Breathe BioMedical is a medical technology and digital health company, and we're working on breath analytic technology as a screening device for disease. We have many research projects underway, but our main focus from the beginning has been lung cancer, which is the deadliest cancer in the world. A staggering 1.8 million people die of lung cancer every year around the world. So after thousands of hours of work, we've been able to complete a lung cancer proof of concept study with results that show we can accurately detect lung cancer 86% of the time, and our work continues. Lung cancer research is close to our hearts. When we found out about the White Ribbon Project, we knew we had to be part of it. We hope one day to provide non-invasive, accurate, and accessible lung cancer screening to everyone. Until then, we need to partner with groups like the White Ribbon Project to educate the public on the risks of this terrible disease. So again, thank you very much. Thanks for being here, and I'll hand it back to Bill.
Great. Thank you, Steve. In closing today, I want to thank everyone who attended. I want to thank our patient advocates again, as others have, for their wonderful stories. Those stories, as we've said, are so important. I want to thank our honored guests for being here to hear the stories, to hear what we're doing, and to bring that back to the environments that you're interacting with, to help us to move things forward with your advocacy and to make a difference for this disease, lung cancer, and the other disease states that will follow with our technology. And we'll keep in touch and tell you more about that as that evolves in the future. I want to thank the White Ribbon Project and my friend Dave Bjork for bringing that to our attention and bringing us into that warm environment. We're so interested in continuing to be a part of this and their efforts with people like Jill and people like Heather to expand that message across Canada, to expand that message into the US, although the White Ribbon Project's doing a great job there on their own, and to expand that message globally as we expand our technology globally. Okay. And finally, I want to close by saying these events don't just happen. Okay. And so for the event here today and all of the logistics that it took to make that happen, I want to recognize Allison and Patty and Kelly. This is not easy, and I think we've done very well and it's gone very well. So thank you. But most importantly, there's a crowd hanging out on the left there that is maybe hiding a little bit in the back. This is the group that got it all done, right? So this is a group that took the concept of the white ribbons and the instructions that Jill provided us and did the hard work within a very short period of time to labor by hand to cut these ribbons, fashioned from the original from Pierre and Heidi Onda, to paint these ribbons, to apply the stickers to the ribbons, and to make them ready to get the message out that you're going to help us to get out, and we'll also get out through our own efforts. So thank you for that team as a drop-in. During the lunch hour, you're spreading hope and love to the community that we're all working together to support and bring solutions to in the future. Okay, thank you, everyone.